Study of clinical profile of concomitant strabismus at Pravara Rural Hospital, Ahmednagar. Strabismus is a generic term applied to all those conditions in which the visual axis assume position relative to each other, different from that conforming to physiological conditions. In simple terms, it is the condition where the visual axis of the two eyes do not meet each other at the point or object of regard. As long as squint is present, the child pays in terms of his sight for each day's delay. The child has a moral right to instant and immediate investigation and treatment. These words, true as they may be, are unfortunately ignored, and thus even in the most modern times we come across children who have paid dearly with their sight for having a squint. Ignorance, illiteracy are the main factors for delay and higher incidence of squint in our country. The society is prejudiced against strabismic individuals, often underestimating their intelligent quotient and stereotyping them. It is of utmost importance to understand that the general societal standards classify strabismus as a cosmetic disadvantage only, failing to realize the functional aspect of this disease. The patients are viewed as inferior to their peers with less appeal as potential friends and partners. However, a review of current literature shows a tendency to denounce the use of the word cosmetic within the treatment specifications in an attempt to highlight that strabismus is a pathological state of the binocular visual system affecting the normal appearance and hence the quality of life. The aims and objectives were to study the clinical profile of comitant strabismus, the various factors involved in the etiology of comitant strabismus, and the association of amblyopia in cases of comitant strabismus. The inclusion criteria was patients with comitant squint under 25 years of age of either gender and those who were themselves or whose parents were willing to give consent. The exclusion criteria were patients with paralytic squint or a history of trauma. Materials and methods are a descriptive cross-sectional study of all new patients below the age of 25 years who were diagnosed to have comitant strabismus at Pravara Institute of Medical Sciences, Ahmednagar between October 2018 and February 2020 was carried out. It included 45 patients. A separate pro forma having details of the patient's age, sex, address, complaints and history were noted. Detailed birth and family history particulars were taken from the parents. Patients previously operated for strabismus were excluded. Routine ocular examination and visual acuity was tested using Snellen's chart where possible. Ocular movements were checked in all directions of gaze. Cycloplegic refraction, detailed fundus examination and orthoptic assessment were performed. Deviation was measured objectively using prism cover test and modified Krimsky test. Before the start of the study, ethical clearance and informed consent was obtained respectively from the institute and subjects. Results: out of the 45 patients newly diagnosed with concomitant strabismus in a specified period, 57.78% were females and 42.22% were males. Then the number of patients across different age groups having concomitant strabismus were as follows. 0 to 5 years there were 35.56% of patients, 6 to 10 years there were 17.78%, 11 to 15 years there were 8.89%, 16 to 20 years there were 26.67%, and 21 to 25 years there were 11.11%. Refractive assessment of the patients revealed hypermetropia to be the most common refractive error at 62.22% as compared to myopia 37.78%. As regards to the pattern of strabismus, preponderance of esotropia 55.56% was seen, followed by exotropia 44.45%. 18, that is 40% of the patients had a family history of either strabismus or high refractive errors in first degree relatives. Amblyopia was noted in 16, that is 35.56% of patients. The distribution in terms of angle of strabismus was as follows. In less than 20 prism diopters of deviation, 8 of them had esotropia and 12 had exotropia. In 20 to 40 prism diopters of deviation, 12 had esotropia and 6 had exotropia. In more than 40 prism diopters of deviation, 4 had esotropia and 2 had exotropia. Discussion: the ratio of esotropia to exotropia was found to be 1.25:1, which is consistent with Mahoney et al. In 2007, Robai et al. And Olson et al. However, ratio was reversed as per Lim et al., Nepal et al. And Matsuo et al. Strabismus was more frequent in the 0 to 5 year age group. This compares favorably with the observation of Aoyesuku et al. Despite the inclusion of adults in their criteria. In this study, a greater number of female patients were brought to the OPD for evaluation as compared to male patients, as opposed to Sarita Behra, Vijaya Kumar Datta et al. In 2014, where males dominated over females. Similar female preponderance was reported in previous studies in Nigeria, Ethiopia, and United States. On the contrary, Azonobi et al. And Atada et al. Reported a slight male preponderance. Although none of this gender predominance was statistically significant, this may be attributed to more aesthetic concerns in females compared to male gender, as suggested by Chaudhary et al. High refractive error and amblyopia were found to be the major cause of strabismus, which was similarly found in the study by Sarita Behra, Vijaya Kumar Datta et al. In 2014. A higher incidence of amblyopia was noted in patients with esotropia than exotropia. Conclusion: a female preponderance was seen amongst the patients with concomitant strabismus. Based on direction of deviation, esotropia was more commonly seen. Hypermetropia was the more frequently associated refractive error. Positive family history amongst first-degree relatives was seen to be associated with strabismus, and amblyopia was also seen in a third of the patients. Thank you.